Dengue fever. The monsoon season has hit India and the threat of dengue emerges again. Dengue fever is a painful, debilitating mosquito-borne disease, caused by a family of viruses. According to the World Health Organization, there are 4 distinct stereotypes of dengue virus. Den 1, Den 2, Den 3 and Den 4, belonging to the Flavivirdae family. Dengue viruses is closely related to West Nile infection and yellow fever. An estimated 390 million dengue infections occur worldwide each year. In India, each year dengue infects thousands of people across the country and many of them succumb to the disease. Severe form of dengue is fatal and seen in 5% of the cases, most of them are children. Most cases occur in tropical areas of the world, with the greatest risk occurring in the Indian subcontinent, Southeast Asia, southern China, Taiwan, the Pacific Islands, the Caribbean islands, Mexico, Africa and Central and South America. Dengue fever is transmitted by the bite of an Aedes mosquito infected with a dengue virus. It can't be spread directly from one person to another person. Dengue has some flu-like symptoms, but it shouldn't be confused with flu. High fever with severe joint and muscle pain, swelling of lymph nodes, severe exhaustion and rashes are common. Symptoms of dengue fever begin 4 to 6 days after infection and last for up to 10 days. It may include sudden, high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea and vomiting. Skin rash appears 2 to 5 days after the onset of fever. Mild bleeding from nose, gums, or easy bruising seen. The dengue triad is a combination of fever, rashes and headache is helpful for the diagnosis. Younger children and people who have never had the infection before tend to have milder cases than older children and adults. The acute phase of the illness causes extreme muscle pains and high fevers and last up to 2 weeks. But serious problems develop in the second stage. This is a complicated form of the disease and handling it is highly tricky. This complication of dengue causes abdominal pain, hemorrhage, and circulatory collapse. Dengue hemorrhagic fever is characterized by high fever, damage to lymph and blood vessels, bleeding from the nose and gums, enlargement of the liver, and failure of the circulatory system. Usually affects children younger than 10 years. The symptoms may progress to massive bleeding, shock, and death. This is called dengue shock syndrome. People with weakened immune systems as well as those with a second or subsequent dengue infection are believed to be at greater risk for developing dengue hemorrhagic fever. Dengue infection is diagnosed with a blood test to check for the virus or antibodies to it. There is no specific medicine to treat dengue infection. Symptomatic treatment like pain relievers like acetaminophen used. Avoid medicines with aspirin, which could worsen bleeding. Take rest, drink plenty of fluids, and seek medical advice. If you start to feel worse in the first 24 hours after your fever goes down, you should get to a hospital immediately to be checked for complications. The best way to prevent the disease is to prevent bites by infected mosquitoes in a tropical area. This involves protecting yourself and making efforts to keep the mosquito population down. Travelers should take meticulous measures to prevent mosquito bites during the daytime. Use a repellent containing 20% to 30% DEET or 20% picaridin on exposed skin. Reapply according to manufacturer's directions. Wear neutral-colored, beige or light gray clothing. If possible, wear long-sleeved, breathable garments. If available, pre-soak or spray out to layer clothing and gear with permethrin. Apply sunscreen first followed by the repellent preferably 20 minutes later. Get rid of water containers around dwellings and ensure that door and window screens work properly. A vaccine is available for people living in some dengue endemic countries, but is not commercially available for travelers. Thank you.